is the rest of Australia at with Omicron cases?
Well, all states and territories have reached their peak and are coming down the other side, and basically about a week ago. And we know that hospitalizations follow infections by about a week to 2 weeks, and therefore we're just starting to see hospitalizations coming down now.
How do you expect the return to school will affect these rates of cases and also hospitalisations?
Look, it will affect case numbers because clearly there'll be some transmission in schools. What I expect is it to cause a bump in the downward trend so that, it goes up a bit and then starts coming down again. So I don't think it will bring the states and territories back up to another big peak again. I think it will just be a sort of bumpy ride down. And certainly states like New South Wales and Victoria have done everything they can to keep schools safe, and I applaud them for it.
Hospitalisation rates in New South Wales have actually been better than the best case predictions. What do you take from that?
Well, one of the troubles is that most previous modelling was based on the Delta strain or earlier variants, and there's been very little in the way of modelling for the Omicron strain, which is not really surprising since it didn't hit us until late December. So I think the case numbers have been much higher than was previously modelled, but we're very fortunate in that we're seeing a similar situation here as we've seen in other countries, that it goes up very sharply, it comes down. This is case numbers, and then hospitalisations start following, and we're at that stage now.
So, Professor Esterman, we zone in on WA now, and of course time has been bought by the closed borders. They've had time to get vaccination rates up, but they have conceded they can't stop Omicron altogether. Do you expect them to follow a similar trajectory to the rest of Australia?
In WA, it's a fine balance at the moment. It really depends on whether there's any unknown infections out in the community. If their contact tracers are on top of things, and at the moment they link to all cases, but it doesn't mean to say there aren't any out in the community. If they get on top of things, then keeping the border closed is a good thing. If things get out of hand, and we've seen how quickly it can go from 10 cases to 100 cases to 1,000 cases, then having the border shut will make no difference whatsoever. So I think the key for WA is to start introducing public health measures now, rather than wait for a month or two. By introducing them now, things like mandatory face masks, social distancing, all the things we're doing in other states and territories, they'll be able to make sure that they don't get a massive spike in cases.
So it really is about just slowing it down, but of course, as they say, you can't stop the spread of Omicron at this point.
No, we know that even incredibly high rates of vaccination simply won't stop it, mainly because it's totally resistant to sort of the first 2 doses. And even if you have 3 doses, it still only gives you partial protection against infection. So we have to have high rates of vaccination plus retain public health measures, which most states and territories have done, and which New Zealand is doing now, and WA has to do as soon as possible.
From what we know so far, Omicron is of course proving milder than strains before it, but also more contagious. Is that where we expect COVID to go from here, or do we expect there to be curveballs?
Look, not necessarily. I mean, a lot of viruses over decades tend to get milder. So things like our common childhood infections, 100 years ago they were killers, and people had big families because they knew that a large number of their children were going to die from these childhood infections. So viruses over decades will get milder, but not over months or years. So we will almost certainly get another variant. It will probably be more transmissible than Omicron, potentially because it can evade our vaccines better. But at this stage, we have simply no idea whether it might be milder or more severe or the same as Omicron.
And Professor Esterman, as we've been hearing, Novavax has cleared its hurdles, should be available next month as a primary vaccine. So do you expect that this will lift vaccination rates in this country even higher?
Yes, I do. Look, the people who haven't been vaccinated by now, there's 2 reasons. One is that they're a rabid anti-vaxxer. No matter what you do, they're not going to get vaccinated, and that's all there is to it. But there's also a group of people who are the sort of the worried people, the concerned people who don't particularly trust the mRNA vaccines, have been very hesitant to get vaccinated because of that, for whatever reason, and they will, in fact, be willing to be vaccinated with Novavax. So as far as I'm concerned, I don't really care. The more people get vaccinated, the better it is for everyone. And if they're willing to have a Novavax, fantastic.